Today, we talk about, okay, in the similar vein to the video I just put out about PA versus MD debate, as far as, or PA versus doctor, DO, MD, whatever, for those doctors that went into doctoring, now you're trying to decide a specialty, and I bet some of you are factoring in time to your decisions. So, for example, oh shit, neurosurgery, 7 years? Ew. Whereas, internal medicine, 3 years and I'm done, yay! But do not let the time be the sole factor in your decision making. First of all, those 3 to 7 years or whatever, it's going to be chump change compared to the number of years after you're done with your training that you're actually doing that job. So think about that. Be like, yo, dude, I'm going to be doing this for like 30, 40, maybe even 50 years from now. That factor is of how little time you spent training. It better be a field that you enjoy doing. So it's really got to come down to what field you see yourself in the most. And I'll be honest with you, a lot of times that decision comes down to who you happen to meet in that field. Because you might meet an asshole doing a certain field and that'll turn you off from that field. Whereas if you had met a different person as an attending in that field that you got mentored or did rotations under, you might be like, oh my God, I want to be just like this person. I'm going to pursue this field. You know what I mean? Because I'll be honest with you, a lot of medicine is pretty much, I don't want to say cookie cutter, but a lot of algorithm based, a lot of guideline based, a lot of similar thinking process of like, okay, if this happens, do this, if that happens, do that, and we'll offer this, if this happens, and day. So like, just depending on the field you choose, you'll be doing just different algorithms, if you will. And of course, medicine is tailored to the individual day. It's, it's a little more complicated than I'm making it sound, but in general, it really comes down to where do you feel like you fit best, whether it's with the staff, whether it's with the material in general. It's almost like high school kid cliques, I'll be honest with you. Like, you get the jocks that pursue orthopedics, you get the nerds that pursue internal medicine, kind of like the whole Scrubs inside joke, but there's a mix of both. You'll see, there's obviously exceptions to every rule, but in general, you'll start to see a little bit of a clique here, and maybe at a certain hospital in a certain part of the country, the cliques kind of gravitate to certain fields, and then in other parts of the country at different hospitals, those same kinds of cliques will gravitate to a whole different field, they. So a lot of times it's just a matter of finding out where you fit in as a person, For example, like emergency medicine tend to be like outdoorsy types, like love to hike and, granola type people, I would say. But I've also met, hardcore Italian inner city folk doing like, hey, how you doing? I'm the emergency medicine doctor. Let's take care of this. Like, I've seen that too, So you get a nice mix of everything. But in general, you'll start to notice certain trends and types of practices and specialties. So you got to factor that in. And then ultimately, you got to be like, all right, what do I want to do for the long term here? Like, do I want to be up people's butts all day, or do I want to read EKGs all day? Like, you got to make those kinds of decisions. You know what I mean? Is the ICU for me? Do I want that high-paced, ICU intensive care physician life, dealing with lungs and all that kind of ish, or do I want to deal with psychiatry, where I'm just chilling, meeting crazy people, all day, and doing that kind of ish. So, and then lifestyle will also be a big factor. Although I wouldn't factor lifestyle in too much. Or salary. A lot of people go based on salary, which obviously is, makes common sense. Why would you pursue a field that's just as hard to do that doesn't pay as well? What? But there's an extent to that holding true. For example, like, I could not look at skin all day, even though dermatology pays more and it's way more competitive to get into. So like, the amount of work that I've had to do to get into it was just like not worth it to me. But if it's a field you enjoy, you will put in that work. You'll be like, I want to do this. I will do the work to get there. What else? The other factor is, lifestyle. So, like you classically hear, surgeons have shitty lifestyles and family medicine doctors have great lifestyles. Not necessarily. Depending on how you want to structure your schedule. For example, look at me. I'm working 2 weeks a month, super hardcore, and then I'm working 2 weeks, or I'm not working for 2 weeks, just chilling in New York City, adult Disneyland, baby. So, you can set up the life you want, So don't let that be a factor. And then again, with pay as well, depending on where you want to work in the country, how much you want to work, how innovative you want to be with your practice. If you're a go-getter and you're a hard worker and you want to, join private practice or start your own practice or be inventive in a new technique or like branch out to doing consulting and this and that, next thing you know, you could be a millionaire as a pediatrician, even though the typical pediatrician salary is like, not that great from averages perspective, right? Don't let the money, the lifestyle, or the time of training ever be a factor. It's probably a little bit of a factor, but don't let it be the consuming factor. Nah, I mean, so yeah, hopefully that answers your question. But if not, give me some follow-up issues you want me to address, and I'll do that. With that said, we'll see you on the next one. Peace.